Test that we're going to be doing is called a vertebral artery test. For this one, I'm going to have the patient in a supine position on a table, and I'm going to stand. The athletic trainer or therapist will be at right behind his head, supporting the occipital bone in my two hands while he's off the table. So I got the whole weight of his head here. And then what I'm going to do is I'm going to tell him to completely relax. I'm going to passively extend or hyperextend the neck, and then I'm going to laterally flex to one side, okay? And then hold it for 30 seconds, okay? The other one that I can do is I can laterally rotate to the side and then flex his neck, again, while he's passive. And again, I hold that for 30 seconds. And if either one of these causes him to get dizzy, confused, nystagmus, nausea, pupil changes, then that could be an occlusion of the arteries. The test that we're going to be doing is called a tongue blade test. For that one, we get a tongue blade, and we ask them to bite down on it so that it doesn't move. And then if we suspected a fracture, we can actually take the end of this and cause a vibration. And if that causes pain or movement while he has his teeth clenched together, then that would be a positive sign for a fracture, mandible or maxilla, or any area where the pain might be. The next test is called the halo test, and for the halo test, if you grab a piece of gauze, if you suspect someone who has had a head injury, go ahead and turn your head. If you go ahead and collect any fluid that you have from the ear, and if you look at the gauze and if it has kind of a halo on there, kind of a yellow color as opposed to red, that it would indicate that it is cerebrospinal fluid as opposed to blood. So that's the halo test. The next one that we're going to do is called the palpation test. The palpation test, it's best if possible to wear gloves. See that this can be done either on one side or both sides. So for this one, what we're going to do is we're going to put the little finger inside. Go ahead and turn your head. Little finger inside the ear. Again, if we had both, we can do it at the same time. And while we have it here, we're going to ask the patient to repeatedly open and close his mouth while applying anterior pressure with my little pinky. And this would cause increased pain or discomfort for a positive sign for a TMJ or temporal mandibular joint dysfunction.